Hi class. So this is our PowerPoint titled Prevention of Burnout in New Graduate Registered Nurses, and we are particularly focusing on what interventions are effective in preventing burnout. It is by Megan Campbell, Ashley Cotting, Quinn Ferreira, and Leah Fitzgerald, and we are a part of the Department of Nursing at Worcester State University. In recent years, nurse burnout has become more and more of a problem. It is particularly common amongst new nurses, which is what this PowerPoint is going to be focused on. It is also common in departments of nursing that have, particularly high stressful jobs. For example, ICUs, emergency departments, and also psych units. So in regards to new nurses, their lack of experience combined with an already stressful job leads to physical and emotional exhaustion, and this is termed burnout. In my research, I found this quote that I particularly liked, and it kind of nicely sums up the definition of nurse burnout. So I'm going to read it for you. Quote, nurse burnout is a chronic response to work-related stress comprising three components or dimensions: emotional exhaustion, depersonalization, and personal accomplishment. For most of us, I think when we told our friends and family that we were going to study to become nurses, they congratulated us and told us that, we really need good nurses in this world. So the reason why they probably said this is because a nurse's actions and decisions and quick thinking can mean the difference between life and death for the patient. So with that being said, it's an extremely stressful job when you know the patient's life is in your hands. I found this quote that I want to read to you guys. Quote, the nature of this occupation places nurses into situations where they are often unprepared to handle due to lack of training, ability, support, resources, or knowledge, leading to a high level of internalized anguish. So there are a lot of factors that play into burnout. I listed a few here for you. The first one is short staffing. So we often see this when we go into clinical at, 6:30, 7 o'clock in the morning. The nurses are running around saying, this person called out sick, we're going to be short-staffed, and you can just sense the tension in the unit. And that's like 6 o'clock in the morning. So it's you're kind of being set up for a hard day. So the second factor I have listed here is lack of quality nursing leadership. So having a good role model, whether it's like a nurse manager or just nursing leadership, can mean the difference between, you loving your job and you hating your job. If your nurse leader is constantly, on your toes and expecting a lot more of you than as a new nurse you can give, it really makes your job a lot more stressful and you really won't like it as much. The third factor I have on here is employee conflict. So if you don't have, good relationships with the other nurses on the unit, you aren't going to want to ask them questions, and it's just going to make for a lot more stressful job if you're always at each other. The fourth point I have here are inflexible policies, and the fifth I have is inadequate pay. So as I said before, as a nurse, your patient's life is in your hands. And sometimes, the pay doesn't really reflect the magnitude of what nursing is. And the last factor I have here is improper work assignments. And I feel like that kind of goes back to the short staffing bullet point. So if you have your hands full with 3 critical patients, and then you get a new admit and you're trying to get through a discharge, it's really not fair, and you can't do the best of your ability during your shift with those improper work assignments.
So why is this research significant to nursing? First, burnout negatively affects the nurse personally. So it can lead to dread about working, mental health issues like depression and exhaustion, both mental and physical. And this effect on the nurse then has an effect on the quality of care that is provided to their patients. So the nurses can develop compassion fatigue, which leads to a decrease in the ability to empathize with their patients, and this has a big negative effect of the quality of care received. Furthermore, this creates a safety issue for patients, as these nurses have lower cognitive functioning due to their exhaustion. And so this can manifest as more nosocomial infections that put patients in an even more compromised state of health. And then finally, burnout increases retention and turnover rates, leading to nursing shortages.
Okay, so this is our research question. Among new graduate registered nurses working full-time, what interventions are effective in preventing burnout? So our population that we're looking at is new graduate RNs working full-time. Their exposure is to interventions to prevent burnout, and the outcome we're looking at is decreased level of nurses that experience burnout. So to start off the review of literature, we're going to talk about what is already known. So according to the research, all nurses do experience some degree of burnout, but new graduate RNs suffer more burnout because of their lack of experience. Nursing is a very stressful job. There's a high workload, often low staffing levels, long shifts, and low control over what your day is going to look like. And this is all associated with burnout. And then another commonality we found amongst the research was that there are severe consequences for the nurses themselves and their patients. And one more thing that we found that was interesting to include was that burnout tends to be more commonly seen in women than in men, and nursing is a predominantly female-dominated field, so that's definitely a factor that we should be considering. So with all these factors combined with inexperience of new graduate RNs, burnout is definitely seen at a higher rate with new grads.
Throughout the literature regarding the problem of nursing burnout among new nurses, the methods of research discussed included self-reporting instruments. Many of the data from these reports were obtained from a prospective longitudinal study known as the LANE study. LANE stands for Longitudinal Analyses of Nursing Education. The LANE study is comprised of different cohorts of new graduate nurses that are followed from their late nursing education years into their first 3 years of working life. The self-reporting questionnaires sent out to the cohorts measured background characteristics such as age and gender, psychological and physical health, social situations, healthcare utilization, sick absences at work, social and psychological factors at work, and professional efficacy and quality aspects of the healthcare system. Questionnaires were sent to the member of the LANE cohorts, and these questionnaires contained 16 items of inventory. The respondents then indicated on a 4-point scale ranging from does not apply at all to applies completely. All items assessed were used to assess the 2 core dimensions of burnout that have been recognized as exhaustion and disengagement. To further analyze how increasing levels of burnout often lead to increased symptoms of mental health disorders such as depression, many researchers used the Maslick Burnout Inventory as well as the Major Depression Inventory to evaluate mental well-being of nurses who are showing signs of burnout. The Maslick Burnout Inventory is a questionnaire in which the participants answer on a scale. They can answer from never, rarely, sometimes, frequently, and always. This inventory, created by the researchers Maslick and Jackson, focused on 3 subscales that are good psychometric qualities. These 3 subscales include emotional exhaustion, depersonalization, and personal accomplishment. The responses to this inventory can then be analyzed to assess levels of burnout not only among new nurses but across many professions. While there are other questionnaires that have been created over the years and other research methods regarding levels of burnout in the new nurse population, these 2 methods were most widely discussed among literature and were most frequently used. Some of the burnout interventions that have been put in place for nurses have showed positive outcomes as measured by participant comments. However, One limitation of these interventions in regard to research is the lack of objective measurement tools and experimental designs to evaluate efficacy. Burnout and job stress have increased in part because of new technology, insurance requirements, and the vast amount of new education needed to understand current and expanding treatment options and new disease processes. Some of the most common interventions noted among the literature include self-care measures. These are measures that include yoga, meditation, psychiatric interventions, as well as counseling. Workplace gestures of appreciation are also important because of the demanding nature of nursing. A nurse can often feel as though all of her hard work and long hours go unnoticed. If workplaces such as hospitals work on creating an environment that nurtures respect amongst coworkers and encourages employees to share their gratitude with one another, the work environment will become one that is pleasant and more conducive to better patient care. It has been discussed in many articles that organizations that implement burnout interventions may experience increased retention, reduced turnover, and performance problems, as well as increased patient satisfaction.
Along with interventions to prevent and reduce nursing burnout, research also projected themes of strategies to cultivate resilient nurses. These included promoting social interaction between coworkers, promoting positive work leaders and environments, focusing on individualistic strengths which would allow a nurse to capitalize on what they best perform at, giving nurses room for growth rather than containing them to repetitive tasks, and conveying the work of selflessness. These tactics to build resilient nurses help nurses shift their focus to improve and take care of themselves for the sake of their patients. A happier work environment where a nurse feels as though they are being utilized will help confidence and increase and promote the personal well-being and the drive of that nurse to take care of oneself off shift as well. This includes getting more sleep, exercise, and altering their diet. Along with the review of literature, future research is always considered. So among the critical analysis of the research obtained in this study, it is found that recommendations for further studies should include the replication of studies in varied socioeconomic environments, which would help support generalization across the nursing field, as well as including objective studies that involve patient variables. And this is likely because much of the research that has already been attained about nursing burnout is mainly qualitative studies that are solely based on just the nurse's experiences. And finally, specified research that holds qualitative data within specialties among nursing will help us compare burnout in new nurses in different levels in different specialties, which can help us determine where there is an increase or decrease across the nursing field. For implications of nursing, the goal is that the research studied will help bring awareness to the common problem of burnout amongst new nurses. We hope that the employers can enact preventative measures to reduce burnout. These can include occasional check-ins to assess work and perception satisfaction, as well as authentic and motivating leadership, which will help nurses enjoy their work environment as well as trust their leaders. And finally, resources that can help with coping and transitions from school to work, especially in new graduate nurses.